everyone, it's Dr. Shea with Learn ABA from Dr. Shea, here with your Tuesday tip of the week. And this week we are going to talk about how to set boundaries, which came up because someone in the BCBA resources group asked, actually it was Chelsea, she's one of our moderators and she's lovely, what people wish they knew when they were a new BCBA. And what took me years to learn that I probably would have benefited the most from, and my clients would have benefited the most from in retrospect, was how to set boundaries as a clinician and a behavior analyst. So we're going to quickly go over that, and hopefully what I learned over the years is helpful to some other people. The first one is that your job is your job. It's an important job. It's a very cool job. It's a job that profoundly affects a lot of people's lives in a really great way. It is your job, though, right? So if you take time off work, there's nothing to feel guilty about, right? Like your job is your job. If your caseload is enormous, it's not possible to give everyone good treatment on your caseload. You have communicated this to your supervisor, clinical director, whoever, and said it's not possible to do. You shouldn't be working 100 hours a week over and over because they're like, well, that's what it is. And, we're like a family and the clients need you and you can't, like there's a lot of guilt in nonprofits. For those of you that work in nonprofits, I did for my entire career. And it's a lot of like, oh, but these guys need you. So I know you're working 80, 90 hours a week, but like you have to keep going because if you stop, they'll suffer and it'll be your fault. It's your job. If your caseload is unmanageable, you've done your ethical duty and communicated that, refused to take more cases and whatnot, like you shouldn't have personal guilt about being unable to manage an unmanageable caseload. So just remember your job is your job. You are not the family of your clients. You're not going to hear from them in 30 years or whatever. And that's fine because eventually you'll have had so many past clients that like, I would like to know what some of mine were up to, but like keeping up with that at this point would be like, I don't know how many hours a day, right? So eventually, if you're in the field long enough, you end up treating your job as a job because you have to. Everyone who doesn't do these things and set boundaries ends up burning out really quickly. So if you stay in the field, eventually you realize this, but it's very difficult to learn. And there were a lot of nights I like couldn't sleep because I was so worried about my clients, and I was taking crisis calls all day on weekends. And I was doing it because I was like, it's my fault, right? If something happens to these guys. And that's true to a degree as a treatment provider. However, there are times at which what you're being asked to do is not really possible. And that's when you have to remind yourself your job is a job. When you want to turn off your phone to watch a movie, especially on a weekend, right? Like your job is a job. There's no reason to feel guilt about that, right? You can just shut it off. It's fine. Which leads into say no. Say no to things. It feels amazing. I encourage more saying no. I love saying no to stuff. But often when I was learning this kind of the hard way, I had to learn that like saying no was actually my more ethical option. Because if I would say yes to too many things, then I wouldn't be able to do the things that I said I would do that people were counting on me for. And I would either not do the best quality work or again, burn myself out and then be useless to everyone, not just this one client that I agreed to do an extra thing for, but everyone for however long it took me to recover. And that's more pronounced because I have multiple sclerosis and the fatigue is brutal. So my recovery from extra exertion probably looks a lot different from you guys. And I don't recommend multiple sclerosis. It's no fun. But even if you don't have serious fatigue issues, this still becomes an issue. So the next time you need to say no, but like you feel like you have to say yes or guilty about saying no, just remember if you say yes to everything, that is the unethical thing, right? Like that is what's going to let things fall through the cracks that are important, result in suboptimal care and attention to things that are important. If you can't say yes and be sure you can get everything done, refer it out to somebody else, or you just can't do it, right? Like, and this leads to number 3, you cannot help everyone. I want to a lot, that you can't help everyone. There have been clients that I wanted to help that desperately needed help due to their environment, intervention, or I had someone that an analog assessment was not feasible because she had eye gouging behavior and posy mitts on and a number of other medical conditions that made things very, very complicated. Um, and even doing like a certain types of assessments were unethical. And I wanted her to have the posy mitts off, right? Like I wanted her to be able to make food because this was someone that really liked cooking, and she couldn't eat, but she could like taste the tastes of things. She wasn't able to swallow anymore. Um, I wanted to work on interventions for her so badly due to a number of ethical reasons. It was unsafe to run more interventions, to do more of these things. I can't get into details because it wouldn't be confidential because it's so specific. But really, like what we were doing for her was the most we could do given our current resources and circumstances. You're not going to be able to help everyone. You'll want to, but you can't actually help everyone. Even like an MD, like medical doctors, physicians, like sometimes their patients aren't helped, right? Like they don't cure every single disease. Laws of human behavior always work. Can we always apply treatment in like a idealized circumstance so that it will work for everyone every time? No. And that's something you have to learn, right? It's just true. But once you realize that and accept it, it makes the other things easier, like saying no and realizing when you're at work, that's work, and other stuff is separate than work. And you have to have a life or you can't be a good clinician, which leads us to a general thing of boundaries, like overall, which is to set boundaries. You're going to clearly communicate like what you can do and what you cannot do and set expectations just like we would do for anything else in behavior analysis, right? So like, I'm able to generally answer calls during business hours. Sometimes on Wednesday evenings I have openings, but on Saturday, Sundays, I do not accept calls. And you set that expectation the very first visit with a client or a caregiver. And then you're not getting these calls and feeling stressed about like, oh, should I pick it up or this, that, and the other, right? So not only you say like, this is when I accept calls, but I do not take calls on the weekend. If something happens over the weekend, this is the crisis contact number, or dial 911, whatever the advice is. Catch up with me Monday morning, depending on the severity. I have been on call in different jobs, and that was part of the job, and that's different. I always did pick up when I was on call, right? It depends on where you're working, but I kept the on-call thing for years after I wasn't on call anymore. And it was stuff that I really didn't need to be on call for. It wasn't life-threatening emergencies, right? Or it was stuff that could be severe, but there was literally nothing that I could do once it was happening, right? Like I would just need an update that the thing happened. So communicate clearly what you can do, and everyone will hear that, but also what you cannot do, because people ignore the cannot part. Like if it's implied, they won't hear it. You have to say, I cannot respond on these days. I cannot take any more clients. I can't take any clients in this geographical area. It just doesn't work. It's too far, traffic, whatever. And then stick to your boundaries. People won't be used to you having the boundaries if it's a new thing. So they'll be like, are you sure you can't? You did it before. Say no. Just keep saying no. It feels so good. I promise. Like do it once or twice and you'll get so much reinforcement. It won't be hard, but the first couple times are hard. Do say no to things. Remember, if you say yes to everything, you're not being ethical. You're just providing like slightly worse treatment to everyone involved. And if you don't have boundaries, if you don't do this stuff, you will burn out and then you won't be able to help anyone. And I've seen it so many times as a supervisor over my career. Often the people who cared the most, that weren't able to separate these things and set boundaries, couldn't keep going as behavior analysts and eventually left to go to other fields and things like that. So really, to do good work, to help people the most, helping yourself and having boundaries is a crucial part of that. And do not let anyone tell you otherwise. So I hope this was helpful, and I'll see you guys a week from today. Also, we have a new partner agreement that I wanted to start talking about a little because I'm excited about it. It's called First Work. It's an app, and I started using it about 6 months ago with my students to practice doing discrete trials in class for undergraduates. And it's a very, very cool app. It's really easy to use. My students have no trouble picking it up without any like explicit training on how to use it after we teach them like what a discrete trial is, right? So it's a cool app. You're going to hear more about it coming soon, but it just helps you plan your DTT sessions and run them without a lot of interference. It's very intuitive. I used it on my iPhone. My student used it on Android. Both worked out great. I'm going to post a link at the bottom if you wanted to check it out and give it a look. It's on the Apple App Store. I'll post the Android link too. But give it a look, check it out. Let me know what your thoughts are. You'll hear more about it coming soon, but I'm also very interested in setting up like a technology work group in the BCBA resources group. So if you want to know more about that or interested in those kinds of things, like post a comment here, DM me, or just stay tuned and you'll see more cool stuff coming from us. So thank you so much. Check out radisright.com. I'm adding new courses every week. The newest one is anxiety disorders, which I'm proud of. I think it went well. And I will see you guys later. Thank you.